Yeah, yeah. Come back, carnival. I can return to tomorrow. For I don't know what tomorrow will bring, so I'm parting away my sorrows. Come back, carnival. For I can return to tomorrow. For I don't know what tomorrow will bring, so I'm drinking. Bring something, cause everybody chanting. I can always get down for the road again. Wallow in the back, get on with my friends. I want you to take something I play it in the air, right now we are playing. I can always get down for the road again. Wallow in the back, get on with my friends. I want you to take something I play it in the air, right now we are playing. If I had one wish, I will wish that I could bring back all the people I miss. Hold a party right now, Larry kick and reminisce. Cause tomorrow's not promised. When you see me laugh on the boat in a pack, make show my name on the list. Officer, I begging you don't leave it. See like another tune, DJ turn up the set.
Good night everyone.
10,000 people
Welcome
jumping at the
to
crowd.
Standard Distribution
Them said
Show
they're not going home, shout out loud. Come back, carnival.
Welcome to our second health talk. We'll get started in a couple minutes as we mic up our panelists. But I would like everyone to come forward a bit. I don't like to see people in the back of the class. Come forward. Let's keep it intimate. I know there'll be questions to come as well. So please don't be shy. Use the chairs to the front of the classroom. These teachers are not too harsh. At least two of them are not too harsh right now in the panel. There's one you have to be a little concerned about. One internist. But please, come to the front. Oh, yeah.
Carnival, I love you. Pop, I love you. I gotta wait till you get back cause I need you. Every day I realize that life's too short. Tell somebody that you love them from the bottom of your heart. I enjoy your life in case it is my last job. Emotions running high, let me see you raise a hand. I'm tired of saying R.I.P. So everybody let me
That was kind of Ronaldo.
Feel the energy in the atmosphere. Put your phone lights up in the air. Cause I'm not waiting until tomorrow. Jump on and let me down the hill. Feel the energy in the atmosphere. Let's pop your hands up in the air. Cause I'm not waiting, I said I'm not waiting. I can always get down for the road again. Well, in the back, get on with my friends. I want you to take something and play it in me. I can always get down for the road again. Bring something cause everybody chanting.
It's just the socoholic. I am a socoholic. Take the cash in me hand, not in me wallet. Tell the gatekeepers that this is a classic. Cause I wear me heart on me sleeve. Anything I say I just mean. And I mean it when I say I am a socoholic. Buy myself a out with me team. Bottle and spoon and cards in a scene. Cause I mean it when I say I am a socoholic. Take a jump if you love the bacchanal. Take a wave if you love the carnival. Take a wine if you love the festival. And say I am a socoholic. It's something inside me blood. It's something inside me vein. When the feeling hit me, I just can't contain myself. The music hit me like wood, but I don't feel no pain. After the first set that I touch, I just had to fet again. I don't win it in the middle and I don't win it front of the stage and I don't win it by the bar and I getting on like an animal. I don't win it in the middle and I don't win it front of the stage and like the air I breathe, it's what I need. Cause I wear me heart on me sleeve. Anything I say I just mean, and I mean it when I say I am a socoholic. Buy myself a out with me team. Bottle and spoon and cards in a scene. Cause I mean it when I say I am a socoholic. Take a jump if you love the bacchanal. Take a wave if you love the carnival. Take a wine if you love the festival. And say I am a socoholic. Sing the channel, I love soca. I love soca. I love soca. I love soca. Sing the channel, I love soca. I love soca. Say I love soca. I love soca. That's why I don't win it in the middle and I don't win it front of the stage and I don't win it by the bar and I getting on like an animal. I don't win it in the middle and I don't win it front of the stage and like the air I breathe, it's what I need. Cause I wear me heart on me sleeve. Anything I say I just mean, and I mean it when I say I am a socoholic. Buy myself a out with me team. Bottle and spoon and cards in a scene. Cause I mean it when I say I am a socoholic. Cause I wear me heart on me sleeve. Anything I say I just mean, and I mean it when I say I am a socoholic. Buy myself a out with me team. Bottle and spoon and cards in a scene. Cause I mean it when I say I am a socoholic. Tell the promoter we not tired yet. So take a jump if you love the bacchanal. Take a wave if you love the carnival. Take a wine if you love the festival. And say I am a socoholic. Socoholic. I am a socoholic. Take the cash in me hand, not in me wallet. Tell the gatekeepers that this is a classic.
Wrong vibes. It's AJ. Move over there. Every justice. So could I got bad vibes? Wrong vibes.
DJ Switch Production.
Move over there. All my soca lovers know. Fall forward. Back it up, no fall forward. Back it up, no fall forward. Back it up, no fling your hands to the sky and fall forward. Back it up, no fall forward. Back it up, no fall forward. Back it up, no very better vibe. How straight are you outside, but get that semi get warm? How you come to party hard, but watching people from far? How you come to have fun, but be rude, cause you're in the mood? Fierce and up, move for sure. Can't even give a what? Wrong vibes. Move over there. Move over there. So could I got bad vibes? Wrong vibes. Move over there. Move over there. courtyard, in the street or in the yard. Soca lovers love from one polo, when I grind to any soca. Soca lovers enjoy themselves, never know when life will end. Auntie her if you lost someone, covered by our angels love. So wrong vibes, move over there, move over there. Soca dog got bad vibes, wrong vibes, move over there.
Thank you.
Thank you.
Okay.
Yeah.
Just pull up my.
So in 60 seconds, we are going to go live.
Mic check.
Mic check.
Standard Distribution Wildy Showroom. And of course, welcome to our online viewers. It's a pleasure to have you for what is our second public health talk. Of course, this is a part of the 60th anniversary celebrations of the Queen Elizabeth Hospital as we continue our outreach to the public. It's something that we have been doing for the entire year, and we'll continue it for the rest of 2024, of course, even after November 14th, when we actually turn 60 years. I'm Shane Seeley, Communications Specialist for the QEH. And tonight's discussion, we have an interesting one for you. Crop over, it is that time of year. Crop over, culture, and cardiac disease. And we have an esteemed panel to take you through the night to give you all the information you need on cardiovascular disease, one of the leading causes of death here in Barbados and really across the region and the rest of the world. So let me introduce our panelists tonight. And I must also say a big thank you to our friends here at Standard who have allowed us to be in this beautiful space again. And I really want everyone here in the audience, a good night to the audience, those who are gathered here, to be engaged tonight as we try to find some solutions to the problems we are facing here in the region as far as cardiovascular disease is concerned. With me on the couch tonight, we have Dr. Dawn Scantlebury. She's the head of the Department of Cardiovascular Services at the Queen Elizabeth Hospital. Good to have you here with us.
Thank you.
We also have coming in from overseas, Dr. Yannick Hume. She's the head of Department of Cultural Studies at the University of the West Indies. A pleasure to have you with us.
Thank you very much.
Dr. Marilyn Lawrence Wright is the president of the Caribbean Cardiac Society. Good night and welcome to the panel.
Thank you, sir.
And no stranger to us here, and to the public in general, a very outspoken health advocate, especially on CVDs, Dr. Kenneth Connell, Vice President of the Healthy Caribbean Coalition, and Deputy Dean. He's in charge of recruitment and outreach at UWI Cave campus.
Thank you, Shane. It's great to be on the set again.
Always a pleasure to have you here, Dr. Connell. I really want to start with you, Dr. Scantlebury, because you really initiated all that is happening, not only tonight, but in the days ahead. You have a busy few days ahead, and I know that you'll share with our viewers online and right here what is to come. But first, talk a bit about yourself and your specialty, what you're doing as an advocate against cardiovascular disease.
Sure. I am a cardiologist, an interventional cardiologist. What that means is that I specialize in diseases of the heart and blood vessels. So I started life as an internist, like Dr. Connell, and then I went on to subspecialize in cardiology. And and then further into interventional cardiology, which is a procedural specialty. So it's kind of at the intersection between surgery and medicine. I'm also a strong advocate for prevention. So prevention at all levels. So, people think that cardiologists are just interested in treating, and I sometimes get people telling me that when I should be encouraging people to go to the fast food restaurants because that would mean that I would stay in business. But no, cardiology at its core is a preventive specialty. We practice primary prevention, secondary prevention, and tertiary prevention. And one of the things that we see, because it's such a busy specialty, heart disease is the #1 cause of death worldwide, in Barbados, in the region, everywhere. So we have no shortage of patients, no shortage of work to do, and we are trying to stem that tide. You realize after a period of time being in the specialty that, we're kind of going about it the wrong way. If we are only treating the disease, you have to look backwards and try to prevent the disease from happening. So then you then have to realize that you have to become involved in those advocacy efforts to reduce that disease from primordial prevention, from infancy, from childhood, from schools, from looking at culture. So that's one of the reasons why I became involved with the Heart and Stroke Foundation. So I am now first vice president of the foundation. I'm also the medical director of the Cardiovascular Disease Prevention and Rehabilitation Program, which is a mouthful. That means that I see patients after their cardiac events, their heart attacks, heart surgery, and we put them through a rehab program, exercise, lifestyle management. We also have a stroke rehab program, and we have a primary prevention program. As I'm also on the Council of the Caribbean Cardiac Society, and that's the society that brings all the cardiologists and cardiovascular disease specialists, so cardiac surgeons, cardiologists, vascular surgeons, internists, together to advocate for good cardiovascular care in the region. I guess I do other things too. I have a day job. I have a day job at the hospital, and that's where you see that tsunami of heart disease coming at us. So that's why it's so important to advocate for primary prevention.
And the public is very happy to have you there. Many people do ask specifically to see Dr. Scantlebury, and I really thank you for continuing your advocacy and your work, not only in the hospital, but further afield. And you spoke just now about making the connections, and we have Dr. Hume here, so I'll let you talk a bit about yourself, because I know people are asking, how does culture fall into this? But first, let's hear about Dr. Hume.
Yeah,
Who is
thank you.
Dr.
Thank you
Hume?
for this opportunity and this platform. Invitation coming from Dr. Connell. We've shared in other panels where he's been the sole medical practitioners among cultural practitioners, and now it's reversed. And it's a great one to begin these kind of intersectional conversations, because I believe the solutions are to be found in that way. So I'm a cultural specialist. I was trained in cultural anthropology, which essentially is the study of human cultures, the ways in which human beings make sense of the world that they live in, make sense of their material conditions, understand the ways in which, the spaces in which they inhabit. And when we think about the degrees through which the non-communicable diseases have really catapulted through this region, and the fact that many of these diseases are lifestyle diseases, we begin to recognize just how critical it is to see that coming together of the cultural and an understanding of what is the culture that informs the choices that people make. Right. And understanding the lineage, the tradition, the customs, the history in which informs those choices, or or informs what we believe, or the perspective of what we believe is available to us, right? It's like, oh, my mother always did that, or we always ate that way, or so how do we begin to recognize that and then begin to shift from there? Because there's an understanding or perception that culture is what we do on the stage and not necessarily how we live and make sense of our worlds. It's not just about music, although music is a part of it. It's not only about the visual arts, but it's the everyday. It's the way in which the ZR man stopped and how that ZR man drives his vehicle in Barbados may be different from the way that Maximan in Grenada or Trinidad drive his vehicle, the way, hopefully, but the ways in which we occupy and really make sense, and what is it we eat, and the choices that we make to eat what we eat, when we eat it, and the portions of which we're eating it.
Indeed.
All of that is informed. And so to have this conversation becomes critical in terms of beginning to think through the solutions that could be made, and especially when we look in the context of crop over, where we have part of what makes crop over part of the aura around it is that it's really propagated on excess in every dimension. And so if we keep, pushing these levels of excess, and it's not just crop over, it's Trini Carnival, Jamaican Carnival, Vincy Mass, Spice Mass, all of these truly quintessentially Caribbean festive arts, which is very much a part of our cultural bedrock. But it's a cultural bedrock that is built on overconsumption of all kinds. And so if we begin to have a conversations about how do we curb or use artists in a way that could galvanize change. And so I think having a platform to begin that talk is really important.
Well, we're definitely starting to make some of those connections already, because you speak of culture and I think about a big plate of food. Big plate of food, and this is what we don't want to see continuing. And you speak about prevention, Dr. Scantlebury, and I don't think that we've done enough, and we need to do more. This is a part of it, these outreach sessions, to get prevention in the minds of our population, and we really hope that we can achieve that. Dr. Marlon Lawrence, right, you look at this from a Caribbean perspective now. What's going on here in Barbados and across the region as a part of the Caribbean Cardiac Society. Talk a bit about your and what you do to really push that message of prevention and other messages that our populations need to hear and to really take heed of.
Sure, thank you. So I'm Marilyn Lawrence Wright. I am the president of the Caribbean Cardiac Society, and that's what's brought me to Barbados at this time.
Not crop over.
Not crop over. But that too. But really an opportunity to bring us together across the region and really see how similar we are in our different areas and how much we can kind of pull on each other's experiences and strengths to have good outcomes throughout the region. That's Caribbean Cardiac Society. Dr. Scantlebury and I are very involved. I'm president, she's a council member. And a lot of what we're trying to achieve over the next few days is really to raise awareness here in Barbados, throughout the region, bring cardiovascular specialists across the region together as we kind of strategize as to how it is that we're going to improve our cardiovascular health in this Caribbean region. I'm from Jamaica. In Jamaica, I am a consultant at the Heart Foundation of Jamaica. Very much, primary prevention, really trying to get out to the communities and advocate for the changes that need to happen to prevent this tide of, stem and prevent this tide of cardiovascular disease. I am a cardiologist. I'm a non-invasive cardiologist. A lot of clinical cardiology, a lot of echocardiography is kind of my area of specialty. So whether it be imaging the heart, stress testing, I interact with a lot of patients who maybe think they have cardiovascular disease, not sure. Maybe some who have established cardiovascular disease, and we're trying to manage it primarily medically. At the University of the West Indies, I am the head of the Department of Medicine and head of cardiology, and there I have an opportunity to really interact more with the doctors in training, and really make sure that that cardiovascular foundation is there and that they understand the importance and their part in terms of bring out to the patients that they see, and to really have them, take ownership of their health and see their part in preventing and treating, recognizing and treating cardiovascular disease. I mean, I think the only other thing I'll mention at this point, which I think is relevant, is that in my time at the University of the West Indies, I did spend some time looking at the idea of programming of cardiovascular disease and the fact that the in utero environment, so what happens with a pregnant female, while she's pregnant, and what that nutrition is like, what that environment is like for the growing baby, can program cardiovascular disease in adulthood, right? So just to say that, prevention is very important, and we talk about it, as you said, from childhood, and certainly that cultural, yeah, we have to go back even a little bit further to the mother and the generation before,
Of course.
and what's happening as that child is being formed. And of course that's going to interact with what happens once a child is born and the environment that the child grows up in. All of that is part of what culture is about. But it's important to look at it from a holistic standpoint and to realize that we really need a multidisciplinary approach to solving the problem.
Prevention better than cure.
Most definitely.
For sure.
Most definitely.
So that is something that I know the doctors, the fraternity continues to preach, but I don't know if enough people are getting the message, and we need to get that message across. Dr. Connell, you have been you've been doing it for years. You've been trying to make those connections through the media, through the several interviews you would have done over the years with myself and other journalists, to help the population to understand that we are not doing the right things as far as eating is concerned, as far as consumption is concerned. Dr. Hume mentioned excess as well. That is something that we are experts in. Talk a bit about your expertise, Dr. Connell, in terms of not only bridging the gap, but of course you do a lot of work in your role at the UWI as well. Talk about these connections and how you connect the dots to get your message across.
Sure, thanks, Shane. Let me start by saying that this is one of the most exciting times of the year for me. One, because I am a crop over junkie. You may not know this. But before I could even walk properly, I remember being on the shoulders of my dad, and my mom is in the audience, going to the Pick of the Crop finals, watching. This is probably before your time, Shane.
Definitely.
Pompey's minibus man come on stage, right? And seeing those kind of things happening. Crop over is my season, and I like to get involved as much as I can in the crop over event. So to have Caribbean Cardiac Society during crop over, I mean, that's a buffet for me, right? Because my academic career really, my first academic presentation was at CCS. And I swore after that I would never do another one. And here I am. So I am full-time faculty with the UWI, in senior lecturer in clinical pharmacology in the Faculty of Medical Sciences, and Deputy Dean of Recruitment and Outreach at the UWI Faculty of Medical Sciences. The smallest, but we like to think the most impactful, but I know colleagues are here from other faculties. And it's so great, I'm going to claim this panel UWI, by the way, because Marlon is head of department, Yannick of medicine at the Mona campus, Yannick is in the Faculty of Culture, Creative and Performing Arts, and Dawn is Queen Elizabeth Hospital, but also senior associate lecturer in cardiology. There you go. So it's a full UE panel. And so I'm an internist by profession. I was, let me just say that my interest in public health happened quite serendipitously because, or maybe not, I see members of the Heart and Throat Foundation here, which is right across the street from the Queen Elizabeth Hospital. I spent a lot of time at the Heart and Throat Foundation learning skills in resuscitation. As you know, they offer BLS and advanced cardiac life support. They also do a lot of work in cardiac rehabilitation. And I thought I was just there kind of learning stuff that would make me a better clinician. And then later I got involved in the organization as a director, and then I'm president. And I'm glad to see the president and new CEO, Mrs. Greta Yearwood here as well, and Mr. Dwight Mosley. So there was that, but that was supposed to be it. And then I recognized, well, you know, this 24-hour call and 8 to 4 at the hospital is exciting. And let me just say, I still enjoy that part of my career. I enjoy seeing patients, I enjoy the emergencies, and I enjoy hospital life. And then I step back and say, you are really only dealing with the tip of the iceberg. And there's an iceberg under this tip that's just growing, you're having no impact on. And so I started getting more involved in civil society organizations. The Heart and Throat Foundation naturally led me into the Healthy Caribbean Coalition, which is a regional group, civil society organization, responding to the Port of Spain Declaration of 2008. and I'm vice president of the Healthy Caribbean Coalition. And naturally, if you're going to talk about health, I noticed that you said we need to eat healthier, but I'm going to challenge that concept tonight by perhaps suggesting that we need to live in a healthier environment.
Yeah.
So we are literally where we live. And organizations or commissions like the NCD Commission, our whole role is to change the landscape, which includes all of the cultural determinants, the social determinants of health. How do we change that landscape such that it is very difficult to live an unhealthy lifestyle and it is very easy to live a healthy lifestyle? And that is our responsibility. I don't want us to lose sight of this narrative that it is not only the fault of the individual. Those of you listening online may think the reason you had Shafet, I saw you, coming home from work this evening is because you happened to pass a fast food restaurant, and it could be any fast food restaurant. But that's not it. The reason you had that is because they were available, and they were available on your way home, and you probably did a lot of work, a lot of time at work. You left work late, you rushed home, you didn't feel like preparing a meal like myself, although I was looking at the kitchen stuff here at Standard. And therefore, you just drove into the drive-thru, and it's convenient. So if it wasn't there, you wouldn't have done it. If there were cycle lanes so that you weren't knocked over by a ZR van, you would cycle to work, those kind of things. So we need to speak more about changing the environment, and culture changes that environment as well. The cultural determinants, I'm going to hand over to Yannick, but this morning I was on my way to work, and I thought about all the things that I did just because of our culture.
Yeah.
And so I had to have a hot drink first, because culturally in the Caribbean, you have to break the gas, right? And I was tempted. I could just hear my father's voice. He's now deceased, but hearing him say, drink something hot first. So I had my coffee in the morning. Yeah. And I listened to the calypso music, because that's a morning routine to get me going. And I recognized that part of my planning my day revolved around my whole cultural perception, my whole core beliefs. No one can look at anyone in Barbados, right, and say to them they're having pudding and sauce on a Saturday, and a Bajan looks back at them, maybe a Jamaican might look back at them and say, really? Why? It's not natural. It's our culture, right? Yeah. That's what we eat, and when do we eat it? On Saturday. So therefore, we need to change.
Fridays and Wednesdays now.
And Fridays and Wednesdays now at certain locations that will remain unnamed. But so the reason we do things is because it's culturally acceptable. And I started thinking about this, and Don and I were discussing this. How can we change culture such that we highlight the good aspects and modify the bad aspects? Because we cannot divorce ourselves from culture. Forget that. Right. And I think it's why it's so important that this session is being held in a cultural cobblepot of crop over. Yeah. I chose that term intentionally, right? Where you have all these cultural practitioners almost on steroids. The creative arts are out there on display. How can you kind of translate that into change in our health behavior? That is what this panel, I think, must address tonight.
Are you calling for a return of Cobblepot?
Oh, for sure. I hope the National Cultural Foundation is listening. Cobblepot is needed.
Okay, so let's get into this. Exploring the links between culture, behavior, and cardiovascular health. And I know this theme was carefully chosen. Dr. Scantlebury, why did you decide that, of course, working with the team, that you needed to go down this route, showing those connections between crop over and culture and these cardiovascular
I can tell you where the idea came from. I was sitting on a plane thinking to myself, well, we're having Caribbean Cardiac Society meeting here, and we have all of these cardiovascular specialists in from all over the Caribbean and further afield, actually. So we do have from other places, and it would be remiss of us not to take advantage of having these people here to talk a little bit about heart disease to the public. And then I thought, well, it's crop over. And crop over exemplifies our culture, and I've been speaking about this a lot, talking with Kenneth, etc. But one of the things that comes to mind when I think of crop over is the fact that we had, it's this celebration of our cane crop. But when you think of our cane crop and go backwards, this was something that was birthed in oppression, slavery, etc. And crop over is kind of like a celebration of our overcoming something, overcoming slavery and overcoming our origins in slavery. But then you think of all the things that come from that, all the echoes. So there's a celebration, but then there are all these negative things that come into our psyche from that background. So, when you're thinking of how we live and how we live our lives, it's important to step backwards. So, our theme for Caribbean Cardiac Society is Caribbean cardiology moving forward, staying current. So we're trying to move forward and take things forward. Obviously, we have to stay current with the literature and understand what's going on out there as we move our people forward, but we also have to look backwards and look at what our origins are so that we can understand how we can move forward. So, all these things going through my mind with a glass of wine while I'm sitting on the plane. And that's where the idea came from.
And that speaks to the prevalence, because when you look at the history and speak about genetics, because that's a big part of it as well, that speaks to probably one of the reasons why there's such a high prevalence of CVDs in our populations, in that populations.
Yeah, one of the reasons. But the major reason is our lifestyle.
It's lifestyle.
And the reason we have this lifestyle is because we're in an environment that is fantastic to have it. It is easy to take the lazy route, right? It is, and I know this, I almost said from experience, but maybe I will say from experience. Any opportunity that I have to travel and not walk, I take it. And I make every excuse. Oh, outside is too hot. And the hospital is too far. The clinical skills building, as you know, is right next to the Queen Elizabeth Hospital. Should I just drive across? It's a mindset, right? Right? And the reason for, but yet, when I travel and everyone else around me is walking, then I walk because everyone else is walking. And the reason why I eat healthily when I am overseas, or more likely to, is because you feel like a real outsider if you are the only person in the line standing with junk food and everyone else has a basket of fruits and vegetables which are affordable and bottled water because it's there. So you change your behavior without even recognizing the impact your environment has had on you. And that is phenomenal. We in the Caribbean and in Barbados, we live in an obesogenic environment. We cannot continue to blame on our ancestral past or our genetics because we now live in this environment that is fantastic, that we've created, and we need to change it. And our administrations need to come to grips with it and begin to change it.
Dr. Hume, I see you nodding here in agreement.
Completely, because when we think about, there is something to say about history of this region, and a history that is steeped in the plantation economy, and with that, a history of dependency. And so, one of the things I have my students do is go into the local supermarkets to just do a study of how many, one was just to see how many brands of cereal are there. And in one supermarket, there's about 27 different brands of cereal, sugary morning cereals, of which maybe 3 or 4 have any kind of regional marketing that was actually developed in the region for consumption in the region. So we import a lot. And that sense of, our palates have gone over to a taste that isn't part of our own. It's become completely colonized. Right? So can we really speak of cultural sovereignty when in fact all that we consume is often from outside of ourselves? Whether it's the media that we consume and certainly a great deal of the food and that we consume. And we could track this generationally, right? So when we think about our grandparents and the parents before them, working the land meant that, in Jamaica, I have come from a people who were grown. So they would wake up, and a tea at that time would have been a Milo and then some biscuit to start. But then they would have their hard food. And that hard food would be a stew chicken, yam, a big thing of ground provisions. But they were working. They were laboring in the field. So the plate full of provisions wasn't sitting in an air-conditioned office to digest. Right? They were actually working and laboring through using their bodies, walking considerable mileage from one field to another, working ground. And this idea, which you mentioned, Kenneth, in terms of not being as mobile, really being sedentary, and that it's a full complex. It's not only about what we're consuming, but the fact that we're not moving as much, that most of our lives, a good section, unless we have our Fitbits and our different watches to keep tracking vibrating, you could spend a good time of your day sitting in a sedentary position, locking out your hips, not moving, not getting the burning of those calories. And so the history of dependency, though, is something serious. When we think about this idea of modeling ourselves after our the colonial administrators, long after they've passed, they still uphold a model of what we aspire to. And so the idea of having progress in modernity means you no longer walk. You drive the latest brand of car. You are able to move with ease. You have the AC bolted up. So that sense of walking suggests you are no longer of a particular class, right? And I was walking the other day. Is there something wrong, Dr. Hume? Are you okay? I'm like, yeah, I'm just walking. It's no longer. It's not seen as something that you do normally or that you would choose to do, especially if you're of a particular class, right? And so these lifestyles, when we're talking about shifting, it's returning to a holistic approach to and creating an environment in which supports a full engagement, a full embodied engagement with the environment that you're living in, moving through time and moving through space, getting on your bikes, going out there and doing these kinds of activities and having it be normal and something that you do as a normative practice. When I spoke about, the culture of excess, and, it's interesting, this is happening at crop over because crop over has shifted considerably from that idea of the last crop, right? For some, the transport of the last canes came and went without some people even knowing, right? And so you have these different layers of crop over, the official national version of which is, supported by the steadfast crop over folks, and you have the cultural entrepreneurs, the creative entrepreneurs who are doing all sorts of fetes and parties and promoting different events as well. And so you have these two experiences or more of crop over, and that experience of the creative entrepreneurs trying to really make a dollar and getting the support often from outside funding agents, but primarily companies that are about alcohol. Right? So when you look at the song, the kind of soundtrack of crop over the past 10 years, if you don't have a drink, a rum, or anything in there that is propagating this whole idea of consume alcohol, that you are not really playing the music of the time, right? And so that is adding to this other layer of, yes, we come from sugarcane and all of that history, but it becomes this idea of you drink till you drop, you get up and you go again. This invincibility, right? And the sense that you could do this and be okay.
Yeah.
And then when we're dealing with the climate crisis here, where, the temperature levels have shifted completely. So you're now consuming all of this alcohol in this heat at the rate with very little rest. And that is part of a system that could only breed destruction at the end.
It's a recipe for, as you said, disaster, especially when you're considering good health. And I want to come to you, Dr. Lawrence Wright, about the Caribbean perspective, and that's why it's so important to have you here. But before I get to that, because of what you mentioned, I have to come back to you, Dr. Canterbury, to talk about the trends now. Dr. Hume painted a picture of what is our reality at Dr. Connell's favorite time of year. People drink till they drop, go again, there's a level of invincibility, but then this starts to cascade into your realm. Then you start seeing more of those individuals come into you, and especially at a younger age now. Talk about those trends and what you are seeing coming to the QEHS, coming to you in terms of for treatment.
Yeah. So I guess to speak of trends, I would then need to go to another UE entity, which is the Barbados National Registry of Non-Communicable Diseases. So that is our entity that collects data about heart disease or myocardial infarctions or heart attack, stroke, and they do cancer and now hypertension. So my interest in the BNR, of course, is the what are our rates of heart attacks, what are our mortality rates, so death, and then things like hospital admission, etc. So early on when they first started collecting the data, or death rates were pretty high. I think some of it is that, you go around thinking that you're doing just fine, and then you look and you're like, oh, wow. So then things change and you put things in place to change. For a period of time, our death rates dropped quite significantly. And unfortunately, I don't know if it's the influence of COVID or what, but those death rates have gone up. But also, along with the death rates going up, our total numbers have been going up over the last decade as well. So in 2020, I think, is the last published year.
Published year.
Yeah, I think we have more data, but it's not published yet, so they're still cleaning data. The numbers were 547 heart attacks. Incidentally, it was 547 the year before as well. About a third of those are going to die before they reach hospital. Another 2/3 will get admitted. Our mortality rates range between 20 and 30%, meaning that about a third of those will die, which is significantly higher. I mean, die within the first, within the hospitalization or early on. Those numbers are significantly higher than the rest of the world. So you'll have an overall heart attack death rate of around 16% in a first world country. And then when you look at the big heart attack, what we call the STEMI, it's a lot lower than that. So one of the things that we have been looking at doing at QEH is try to see how we could interface with urgent care centers and primary care, et cetera, to improve care outside the hospital as well as inside, so that we can improve those lines of referral, et cetera. So some of the reasons for the increases are in deaths are maybe due to, or variations in death may be due to management, but we are looking at increases in total numbers, so that has to be related to changes in our lifestyle. Our population, as we all know, is not growing. Our population is stagnating. It may be getting a little bit older, but it's not growing. And so, the thing is, the heart attacks are occurring at a younger age too. So it has to be lifestyle.
Yeah.
And it has to be a changing of the guard as far as our lifestyle is concerned. I guess that comes back around to culture and
behavior.
Yeah,
behavior.
And those are the connections, the linkages there that we're really trying to address here tonight. Dr. Lawrence Wright, speak about what you're seeing regionally as you gather the statistics from our member states.
So a lot of what has been said really resonates with me. I kind of want to go back a bit to the whole idea of our diet and the transition that we have gone through. You know, because I think if we think about our traditional diet, and I think it's pretty common throughout the region, it tends to be high in salt, right? High in sugar, high in fat when we think about our traditional dishes throughout the region. And those are things that I think we would want to try to change. But in the past, we weren't necessarily seeing as much in terms of our cardiovascular morbidity and mortality. As you said, because we were more active. So we were more active. We were, whether it be out on the on farms or whatever it is, kind of tilling the soil and so on. We were active, and so there weren't really excess calories.
Right.
What has changed is that we're not as active. We're modernized, and we're inside, as you said. We're driving the cars. We're in AC and so on, and so we're not expending calories. Right? And then, as you kind of alluded to, we have refined, quote unquote, refined our intake. So it's not the grown provisions. It's more, as you said, the cereal, the processed, the rice, the pasta, that kind of thing. And our portion sizes are all right. So, I mean, I know certainly in Jamaica, if you're going to get a meal, it's probably going to be a lot of rice, maybe rice and rice, quite a fair amount of a portion of the meat, and very little vegetable. And many times vegetables are not going to be consumed. So I think just yes, exactly. So I think in terms of what's become the norm, it's gone in the wrong direction, and then we are less active. We're more sedentary, and so the effects of that are even more.
Yeah.
Right. I think what has happened is, as you said, Ken, when you go abroad,
Yeah.
You get in the salad, you get in the water, and maybe some of that is coming into our region now in terms of that
cheaper.
being something. What is cheaper?
The vegetables and the water and everything.
Well, interestingly, so in Jamaica it's not really, because so the thing about it is, I think especially with the influx of the fast food,
Right.
Enterprises and so on, it's cheaper to eat in an unhealthy manner. You know what I mean? Right. So it's a lot cheaper to get the fried food,
Right.
You know what I mean, than it is to get a salad.
Right. Yeah.
So it's kind of interesting. Like, I guess, as you said, we need to create the environment where it's easier to live in a healthier way. And we know that involves, advocating with government and really getting a push to have the healthy choices be affordable.
Yeah.
I think that's definitely something that we need to emphasize, and part of what we need to do throughout the region.
Yeah.
So that was one of the things that I kind of wanted to emphasize.
I think that is it. I think that's critically important. But what I want us to not lose sight of is that we are in the middle of a public health crisis, and that's not exaggerating. Let me just put that in context. So we spoke about changing the environment. Barbados is currently facing a crime problem. Everyone watching this in the audience, as well as at home, would agree with that. We don't make guns. We don't make ammunition, to my knowledge at least. All these things are imported. We are having a crime as a public health issue, yes, because of behavior, but also because of a neo-colonial construct where we are importing these weapons into the country. We have an NCD crisis. Where are we getting these unhealthy foods from? We are importing them. We are importing them, and we are putting them on the shelves of supermarkets and in restaurants and in various places. And you know what we're doing? We are concealing them. They're not hidden behind screens, but do you know if something is high in sugar? Do you know if it's high in fat? Do you know if it's high in... You don't know unless you can read a nutrition fact, and unless you have a magnifying glass. We don't have front of package warning labels. So we have unhealthy products in these that you can go out there and purchase, and you don't even know what you're purchasing. You just know it tastes good and it's cheap. We are setting our people up, therefore, for a disaster. And it's the same thing. You ask how culture responds to it. Let me give you some examples of how crop over has responded to it in the past, right? We had an issue in this country with domestic violence. Our creative artists came out, there were several calypsos and everything, addressing domestic violence. We have an issue with crime. I am sure that when I watch the Pick of the Crop finals, in addition to hearing comments about one healthcare institution, I am going to hear about crime. Right? I'm going to hear about crime. Because it's what's topical. We had HIV/AIDS, and you had the HIV/AIDS ban. You had HIV/AIDS. Where are the calypsos? Where are the creatives? Where is the focus and crop over on NCDs? The reason why it's not out there is because it's not seen as a public health crisis. And it is. It's claiming more lives than HIV/AIDS. It's claiming more lives than
crime.
And it's
cancer,
rampant. And
yeah,
yet we have become so accustomed to it. I was in the supermarket recently, which is not a common occurrence, and I saw a young child picking up a sugary cornflake. And the mom did the right thing. She said, no, that's loaded with sugar. And someone passed by, and see, this is where culture comes in, because in another country, that person would probably have been arrested. She said, but look at you, child. You could eat some more sugar. You starving, she. That's our culture. Fat kids are cute kids. Give them some more sugar, they'll run it off. All those sorts of things you hear, right? We need to change this. And I think that institutions or organizations like the NCD Commission have a role to play here, because let's face it, on this panel we can't change an environment. There's only one group of people who can change an environment, and that's the administration, right? It's the same. All of us we can try to live a crime-free life and everything, but who is going to protect us? That happens at a national level. Law enforcement, things are put in place, laws are refined. These things come from the administration. That's how they change the environment. So I just want to close by saying that part of the problem with the non-communicable diseases is it no longer attracts the public attention as a crisis. I'm sure there are people online tuning out saying, oh, geez, hypertension, diabetes, sugar, fish cakes again. What else are going to tell us it's new, right? But if you see a crime statistic comes up, it's going to grasp attention. If you see an infectious disease come up, it's going to grasp attention as well, because there's an urgency. We need to get back to the table and make NCDs an urgency.
Yeah, and that's why these statistics are so important. I know you mentioned that the last set of data that we would have put together was from 2020, so it would be good to get those updates on some of the years subsequent.
And they're coming.
They're coming. They're coming.
They're coming. And you spoke about the NCD Commission. What about the university's role in dealing with this situation, responding to this NCD crisis, and especially cardiac and CVD problems?
Yeah, the university has several critical roles in, shall I say, aligning culture and health and wellness. First of all, our research must be culturally sensitive. We can't be consumers of research coming from North America, which may not be culturally relevant or even relevant to our health landscape. So that is one thing. Our research and the questions we interrogate from an indigenous university like UWI, they need to be culturally sensitive. Secondly, we are creating the next frontline workers of health practitioners. They also need to be culturally sensitive. We can't have the next generation of doctors out there leaving UWI who have no idea of the culture around them. And I said, embarrassingly, to a group of students recently, I said, you know what? What's a typical Bajan breakfast? And they said to me, bacon and eggs, right? Yeah, right? So we have to make sure, and maybe that's the typical Bajan breakfast now, right? So we have to make sure that our next generation can understand the culture that they're practicing health and wellness in and make reasonable recommendations to change. You can't say to someone going out to a crop over event, you must not drink alcohol. But you can say you should limit the amount of alcohol you consume. If you're driving, you should not drink. If you're going to the bar, you should space your drinks 1 to 5. You should try those kind of things. You can also say to FET organizers, I know you know FET organizers, Shane.
Me?
You should have a separate water station where people don't have to wait in the line just to get water.
I was about to say
Right?
one of the first things that we should do in terms of, because we're talking about solutions as well.
Yeah.
Water is very important.
Water is important.
Water is critical because the alcohol, dehydration. You start with water and you limit the number of drinks you have. And I think people will still be happy enjoying the event, the fete during crop
But they'll be hydrated. Yeah. And also, where's the health information? We are now almost towards the end of crop over, right? Or somewhere in the middle.
Fast.
It's gone too fast. But we haven't heard at least to my knowledge, any public statements about remaining hydrated at all of these events. We haven't heard any public statements about reducing the amount of alcohol consumption and drinking responsibly, right? We haven't heard any public statements about going out there in the heat and ways to protect yourself against the climate change. I know some fed organizers have made changes. Some events are now held at night. But all these things, you know, this is prime opportunity for someone who's going to be a reveler on Crop Over Kadooment Day to take stock on their hydration status. We can't claim that we are addressing NCDs as a country if our main cultural event is divorced from it. That's just
Exactly.
not possible.
Exactly. That's why it's so important. Yeah. I really want to hear Yannick's presentation.
The education system and the ability to, like, what are students learning about? I think there are those from the primary all the way through who are disengaged from the things that we eat, our local fruits, no sense of what they are, no sense of their season. And so this disengagement means that going to a Burger King is easy because you see it, it's there, and you know it's on your way home, as you're saying, for bacon and eggs. And so how do we find ways through media where you could talk about, you know, making Irish moss punch or a peanut punch or hominy porridge, you know, corn porridge, and how do we begin to integrate things that were healthy or are healthy from our past that have been rooted in our Caribbeanness, part of who we are, and bring them back as something that isn't of the old world, something that isn't ancient, but these practices that are partly definitive of who we are as a people, and incorporated as something normative. I think what has happened, and culture isn't stagnant, it is going to continue to evolve and change, and it envelops different influences. And in the same way that pasta has become part and parcel of many of the diets across the region, I think there could be more that is done with things like cassava, right? Breadfruit. And incorporating other, we get tired of eating pickled breadfruit. Well, Jamaica, well, they roast it and then they put in coconut milk and then you fry it up. And in Cuba, you do it the next way, right? The juca sticks, right? So creating a way that you could have a pan-Caribbean approach to some of the hardcore provisions, but a new wave, a new spin of how you make cocktail bammies. So, you know, these big bammies I grew up eating, now everything in this dainty small bammy that's thickly. What some of our local entrepreneurs are doing with tacos, for example, and making taco shells with breadfruit or plantain, and creating using these staple crops, but spinning them in a new way to make them prepared fastly in a rapid way, but also that you could have it while you're driving. You know, those kind of, we have to realize that part of the reality of changing the environment is going to take some work, because how many people are working 8, 12, 16-hour days out and about, and the ability to actually take stock and cook and take that time and bring that the care. I mean, the Caribbean, we were the original slow cookers. You know, where meals start 3 days before with seasoning. You know, it would take time to catch flavor, and then the time that it would take to cook. Time is no longer a resource that we feel we have, and so it lends itself for this kind of need to fulfill our needs rapidly.
We have to accept that, though.
And we have to accept that.
Yeah, we have to accept that life has changed, the times have changed, and, you know, this concept that, we have to eat. You know, you really have to cook. You have to cook. No, I don't have any time to cook. When am I going to sleep if I cook, right? You have to accept it. You just have to evaluate ways to you know, to work with the lifestyles that we have.
Healthy fast foods. I think the movement of these mobile food trucks, right? Yeah. And having those options, healthier options in those food trucks, I think would be a way forward. Expanding a global fusion kind of menu, but that is grounded in in healthy foods. Healthy food doesn't denote bad tasting food.
Absolutely.
And you're finding that you expand the appetite, you expand the breadth of choices, and that will be part of allowing folks to feel, yeah, I'm part, because when you're traveling, you're eating different things, you know, and with the cost. The mention of cost is something the cost of living is exorbitant. So it means that the choices that people are making oftentimes is how far their pockets could stretch. Yeah. So that level of how do we make the healthy options reasonable, and that's a real.
Or to change behavior, yeah.
I think we can engage the media to help with that.
Yeah.
In terms of what you said,
Definitely.
with promoting healthy menus, you know what I mean, and pulling from across the region and making it locally available in different territories.
Yeah.
I think that's something
cooking
that we
programs,
should, yes,
you know,
and
exactly.
So I think this question across the board then,
yes.
is the media doing enough to promote not only living that healthier lifestyle, but prevention and awareness of the issues that we face here in Barbados and the region?
No.
Simple answer.
No. When in March, February 2020, when, you know, over in Wuhan, China, there was this, you know, this inkling of this epidemic starting, you know, this virus that was killing people. And, you know, we were stuck looking at the screens for hours. My TV actually came on during COVID. I don't watch TV, but my TV came on during COVID because I was stuck looking at these images of, you know, the dashboards, the COVID dashboards, you know, what is happening in this area, in Italy, in this place, that place, how many people are dying, because it was constantly in your face. You couldn't escape it. And people changed because of it. You know, people started washing their hands more. They started, you know, social distancing because there were these messages to do these things to try to reduce the spread of COVID. Yeah. Of course, you know, after a period of time, everybody got sick of it and they stopped because they wanted to get back to normalcy. But the media was instrumental in making sure that happened. This is crop over. This is probably the only event of this ilk in the media in in Barbados, and the audience is sparse. And hopefully, the online audience is significantly more. But this is not what people are interested in, and because you turn on the radio, there is all the ads for Tipsy or all the I just
all
know
the
Tipsy,
events.
all the events, but nothing saying you're going to die from a heart attack at the age of 50 if you continue on this lifestyle. It's the media has to do more.
Yeah.
I
Go ahead.
Yeah. Now, I was going to say in Jamaica, I think the media is beginning to do a bit more. The question is whether it will be sustained. There have been, there's been a big push by the Ministry of Health and Wellness to kind of promote healthy lifestyles, the Jamaica Moves initiative and so on. And a lot of that is seen on the TV programs and trying to get the youth involved in that. So I feel as if there is a thrust, but it's a matter of making sure that it's sustained and that it's received and internalized by those who are watching or not watching. But maybe we need to vary the programming because some persons are probably not watching those programs. So,
but there needs also to be a policy and it doesn't have to be from up above, but there needs to be that understanding that what you reap you sow. And if we are reaping alcoholism and an obesogenic environment, we will sow the end result of it. And it doesn't make any sense singing about the healthcare institution without looking at what is causing that healthcare institution to be in the situation it's in. The healthcare institution that was built 60 years ago for a population that was significantly less that would have a heart attack a year. That's probably how many heart attacks we would have a year. And it was typically a tourist coming off a airplane or a boat.
Smoker, everything.
Not our population.
I wanted to flip the script a bit not only because I'm in the media chat, but also because I know some members of the media may attack me after. Not you, Shane. But I just wonder, are we doing enough to sensitize the media now?
Yeah.
Is the media doing
Yeah.
enough, but are we doing enough to sensitize? So quite often, the medical fraternity is not available to speak on these issues. If we are available, we are not as palatable as we should be when speaking on these issues. And if we are available and we are palatable, sometimes we're not speaking on the relevant issues. So the I believe it was the NCD Commission, but certainly involving the Ministry of Health and Wellness, had media training at the Barbados Hilton this year. And we were just surprised at the enthusiasm from the local media. They wanted information. They wanted to know where to get credible information. And they wanted to know who are the people who they should approach to speak on certain things, right? So that's one. The Barbados Childhood Obesity Prevention Campaign has also done media training, right? They've done more than one session with the media. So it is, the media can only reflect what we want them to say. And we have to be available. We have to say what we want to say in a clear and media-friendly way. And we have to respond to the issue. So for instance, is the media responding to the Crop Over festival and health messaging? How many doctors have gone out there, or healthcare providers, and said, well, you know, I want to do a message on water consumption and the importance of remaining hydrated during the season? Now, media is also a business, huh? So we know very well that you are competing. The Heart and Stroke Foundation ad will come up during the CBC Evening News, and then you'll see another ad come up advertising a certain ice cream. But you are a business, right? So are we now in a state where we have to use clever marketing to work with our media practitioners to get the message out? And I think that, yes, the media is doing better, but I think we can also do a lot more to help the media.
Yeah. In terms of even creating the content.
Creating
right?
content.
As you
Yeah.
were speaking, sorry to cut you, but as you were speaking, I was thinking about, you know, creative artists, even those who are making TikTok reels, right?
There you go.
And the ways in which a lot of information, going back to your point about during COVID, I mean, so much information wasn't just coming to you from your television screens or the radio, but on your phone, right? So whether it was memes, reels of information, you were inundated, some of them quite comical, right?
Of course.
But the information being able to be transferred in that way. And I'm thinking about how do we galvanize, for example, students in the film program to do animation,
Absolutely.
little clips of which they could then, these could be part of an app, part of just entering in that what you upload somewhere, send to a media house, have on your phones. But this idea of creating the content that is digestible,
Yeah.
right? And being able to partner, for example, having a filmmaker go and speak with medical practitioners about, so if, you know, how if we're going to do a skit and creating that, whether it's animation, whether it's other forms, but allowing that to be able to be the language of communication.
Definitely. Because you're the communication expert. Literally, you are. But the media is communication expert. And you need to tell us, quite frankly, sometimes, well,
What can
I
we
don't
do
think that
better?
that communication strategy is going to work for the message that you want to get across. And we have to be receptive and listen and say, maybe a 1 hour lecture is not the best way to get over
No.
heart disease stats.
A T-shirt
Right.
sometimes
There
could
you
go
go.
a long way. We have to make
Yeah.
healthy
Or a meme.
So the
sexy, or a
doctors may
meme,
now have to
right?
hold a little party, and during the
Yeah.
party we put up some messaging, you know, about not consuming too much alcohol.
There you go.
Making sure you drink water. That's
To
just
hydrate,
already
yeah.
outside
You
of the box and off of the.
Although I have to
off
say,
the-
a lot of doctors are just very dry people.
Well, that's why partnerships. That's
I
why
had this
partnerships are
conversation with
important.
Dr. Connell recently at one of the forums that he had set up about doctors being on social media and doctors being more active and wanting to share information. And it's not about advertising your practice, or, but it's just about sharing information, especially in your specialty.
Yeah.
For
Yeah.
instance, cardiac disease, so that you're respected in your field, people will listen. People will listen. So social media is definitely a tool that I believe, as I said at that time, that doctors need to use to their advantage. Because you would be surprised how many people, young people, know that they're suffering these conditions. They want the information, but they find it hard to reach the specialists. So that's why forums like these are so important. And that's why we'll continue with the outreach at the QEH especially, so that we can get the message to the public. It's a process. I always say this. It will not happen overnight. And it's good to see all four of you here, because you're making the effort. You'll continue to make the effort to reach those populations. But we need to keep the conversation and the effort going so that the mortality rate does not increase any more than it is right now. And we are already worried, and we have to get those statistics as well. The media, they jump at statistics, they jump at numbers.
Definitely.
Yes, they
because
do.
it's
Yes, I
easier
know.
to understand. Some of the
Excels.
more technical stuff
Yes.
in cardiovascular disease and in heart health may not be as easily digestible as when you say, 6 in every 10 persons, or I'm just calling random stats, 6 in every 10 persons between the age of 30 and 40 are now seeing increased levels of cardiovascular disability. So that's just an example. I know the audience, you will have questions, and we'll send around the microphone so that you can be a part of this conversation. This conversation is not only here, these are the experts, but they're here to answer your questions as well. And I have a question online, so I'll just go to that very quickly. Brother Vincent, he's asking, is there a CARICOM or Caribbean plan to tackle the pandemic of cardiovascular disease to reduce mortality and morbidity? Can someone expand on that?
I see people looking at me. I didn't stage the question, but let me just say it is an excellent question. And I don't want to really belabor the pandemic, but if you think about the national response to the pandemic, it was driven by a CARICOM response. There was strong CARICOM leadership. We got together as a region and we decided how we could pool our resources, how we could lobby and become a stronger voice together. That has to happen at the CARICOM level. And so you have the example of the CARICOM leading in NCD prevention. You have the 2008 Port of Spain Declaration, right? So you have that already established. But we, as electorates, we need to push administrations to see NCDs as an urgency. In other words, there should not be a CARICOM meeting unless NCD is an agenda item. It is threatening the livelihood of too many CARICOM citizens for it not to be. So you can go and you can discuss crime, which is important. You can discuss climate change. You must discuss NCDs, or not you are failing the people that have put you there to serve. So at the CARICOM level, that conversation needs to occur.
Dr. Lawrence, right?
Yes.
Okay.
But I was just going to say in terms of, because that's definitely a strong agenda that has been happening across the Caribbean CARICOM, but I know one of the things that the Caribbean Cardiac Society has been trying to push for a while is just in terms of our response to heart attacks. Our whole STEMI network is something that we really have been pushing. And the idea of having a regional approach that really, standardizes and raises the level of care available to patients who have heart attacks. Set protocols that are throughout the Caribbean region. Wherever you are, should you have a heart attack, maybe you may not be able to get the highest level of care. Maybe you don't have a cardiac catheterization lab in that territory. But can we have a proper network where the people who are on the ground can recognize it's a heart attack, can know who to call, can run that network to try to get the best of care available
And
standardize it and have it available in the quickest amount of time. So I think that's something that definitely we've been trying to engage CARICOM to roll out across the region.
And that's an important product.
Yes. Dr. Scanterbury?
Said a specific product. I suspect that one of the issues that we have is that there is this approach to NCDs as this mass thing, and they're not. So say STEMI. STEMI is ST elevation myocardial infarction, or a big heart attack, for want of a better word. It has a specific type of treatment, and treatment, you need to recognize the signs, etc. So you have to have a systematic approach to managing it, to not only preventing it. So people think only of the prevention, but we also need to identify the specific condition, identify what's going wrong with it, and come up with approaches to that condition. So I think that is where the subject matter specialists come in as well, and that's why CARICOM needs to engage with us more. So engage with Caribbean Cardiac Society, engage with the hypertension specialists, and engage with diabetes specialists, engage with us where we work so that we could tell them what the issue is. So always coming back around to people lamenting how bad our healthcare institution approaches some things. There are reasons for that. It's not that people are sitting on and twiddling their thumbs. It's just, sometimes we feel as though we're, a voice singing in the wilderness or crying in the wilderness and no one is hearing us. We're saying these are problems and this is how it should be approached. So on one end you have people talking about NCDs in generalities, but you have to look at specifics as well. You have to come to us and ask us, what really do you want?
Yeah. Go ahead.
Yeah, and these are some of the solutions.
Absolutely.
That we want to come to the fore. We want to hear from the audience as well. If you have any questions or comments for our panel, I think we have the microphone there so that we can make sure we hear you. Go ahead.
Thank you, panel, for this enlightening discussion. I was trying to, when I first heard the topic, culture and cardiology, that mix, it created some excitement, but I can see how it really hits right back home to our NCDs, our lifestyle, and so. But in all these discussions, we hear statistics on the number of deaths. We hear about the high bills that the government has to undertake in these NCDs and so. But what about the stakeholders, the importers, who really play a very important part in what we consume? Because we know that Barbados, we don't produce anything, we import everything. How do we get out there to these persons, these stakeholders? Because at the end of the day, they're the ones who are going to be responsible for helping to create the change. On mornings, you see children going to school, they have a bottle of water, but in the box they have a snack, and that snack is full of dye, full of all types of things. They even stop sometimes and they buy the processed burger on the street. So how are we going to get the message out to the administrators that this discussion, not only for the healthcare, but also for those stakeholders, because that is the only, I see that as the starting point as we import everything.
Except sand and sea. Yeah. I think that the Heart and Stroke Foundation CEO has hit the nail on the head there. It's what we commonly would call the commercial determinants of health.
Yeah.
And we are especially susceptible as small island developing countries to commercial determinants. But who regulates the commercial determinants? And to what extent are the commercial determinants manipulating the health agenda? Because that is also possible, right? With people, there are industries out there who have the best intention and have corporate responsibility and will do things in the best interest of the health of the public. And there are others who will do things in the best interest of their profits.
Right.
In other words, they put profit over people. But again, regulation comes from administration.
It comes from administration. So it all comes back to
exactly. So no company is going to go out the way and say, you know what, I really want people to know how unhealthy my product is. Therefore, I'm going to plaster it with hexagonal, octagonal warning labels, black octagonal warning labels all on the front. So I want people to know that it tastes good, but it's bad for them. But if they were regulated to do it, two things will happen. They'll have to do it, one, or they will change and reformulate their products so that they're healthier.
And the Ministry of Health is aggressively going that route in terms of front to packaging warning labels.
Well, you said aggressively. The Ministry of Health is going that route, and we hope that it will be aggressive, yes. and we also hope that the public will understand why it needs to be aggressive. We are here in Standard, right? And there's no way any of us in here we're going to buy any product, and let me check because I see some people here from Standard, without knowing all the details about the product. And
Especially
no one's
price.
going to read the fine print. You're going to say, well, how long is the warranty? What does it mean if I break the warranty? What can I do to break? How can I get this thing repaired and in what time frame? But yet we are going and consuming things. We have no idea what we're eating. And more importantly, we are influencing behavior of future generations. The kid in the supermarket who's buying the corn kernels or the frosted flakes doesn't see the black. I mean, she can't tell me what percentage carbohydrates. Can't even spell carbohydrate, right? The child I saw. But if she saw a black octagonal warning, she's like, "Mommy, this isn't good for me." There are 3 of them. We can't have that. We have to have something that's healthier. So we have to try to stop concealing the unhealthy stuff. And again, it has to come down to regulation. You can't, as much as you go out there and say to all the bad men, put down the guns. You know, it's not going to be a whole kumbaya moment, and that's all going to happen. You have to change laws. You have to increase penalties. You have to increase the bite of the police force. You have to, those kind of things have to be enacted. And none of us on this panel can do that. So again, it all comes down to the administration.
What I think this team can do is influence the agenda.
There you go.
And
that's our role, and that's what we need to be vocal and clear on.
And this is a perfect platform for you to do just that. Because even when this is finished, this will be recorded, and we will definitely be sharing this message so that more and more people understand what needs to be done to address the scourge of NCDs and especially CVDs in our society. Anyone else from the audience?
Thank you, panel, for a wonderful discussion. I think drawing the link between culture and health is very, very important. And I know you've been pushing the policy agenda, making policies. But we also have to go hand in hand with changing the culture. And for example, I want to bring the school nutrition policy into the discussion because it's a policy by government. They have implemented it.
Absolutely.
But the stakeholders in it are not buying into it. So you have teachers that will not succumb to saying this is what we must do in our schools because it's not a culture yet. So both have to go hand in hand. How do you change the culture and how do you have the policy and make sure that when it's implemented, people will buy into it? So we still have the problem of vendors selling outside the school. You know, and it's not a political will to touch it. Selling the wrong things. So those are the discussions, the conversations that we need to further and further it among the stakeholders. The other part of my question to the panel is how do we reach where we need to reach? So we know that a lot of these issues are falling into a certain category, a certain class, certain economic category. How do we reach the audience? We're having a discussion here. I'm sure that a lot of those persons are not in this discussion. And I know you've mentioned it, you've talked about being on social media. How much more can we do to reach where we need to reach with the message?
One thing, schools. It doesn't matter what social class you're in. Everybody has to go to school, you know. Otherwise, there are the truancy laws, etc. So that starts it. That starts it off with children. That's why talking about obesity prevention at the level of childhood is so important. That's the first thing that comes to mind. You reach your society through the children. You also reach it through the community. One of the issues that I find that or that comes with our culture is that the progressive degradation of community.
Sure.
So whereas you had the community, you had your farmer, and the village, and You know, the farmer had the greens and the yam and the sweet potatoes, etc., and you could go and you get your healthy food, etc. Now, you know, the community is not built up around that concept of being self-sufficient.
And the local wisdom that exists within those practices, right? We saw a bit of it during COVID and during the kind of moment of the pandemic where, you know, those in the Rasta communities were speaking with farmers about different, you know, alternative modes of healthcare and of wellness and conceptions of wellness. That knowledge is very much part of our reality, but there's in our culture, but it's often peripheralized as something, them people do push, you know, and bush medicine, but there's a lot of knowledge there. There's a lot that we could tap into in terms of recognizing the wealth of information that still exists there with allopathic treatments, with, you know, standard Western medicine, but being able to put those in conversation. Indeed, the schools as a platform for beginning to spread the word and developing programs, curricula, developing also competitions even in terms of allowing students to take part. I'm not sure what they teach in home ec or food and nutrition, what, you know, those could be really having a clear agenda that is addressing some of these matters in a systematic way where students are learning not just about, you know, the food groups, but really engaging, okay, what do we mean by these food groups in a practical way, I think would be essential in the same way that you have these community groups that are linked to churches, that part of their programming could include food and nutrition, that to begin to build that out. So you're learning about the Bible, but you're also learning about how to eat more mindfully, right, and more holistically and in a balanced way. And also, speaking of this platform of Crop Over and other events, it's not just Crop Over, there's NIFCA, there are many platforms throughout the year of which the messaging can be translated. And I think these signposts need to be consistent so they become everyday. They become part of the norm. And that's going to take using the creative platforms, the expressive forms to be able to speak about this, whether it is through theatrical arts, whether it's through film, whether it's through music, but using the platform that are available during national occasions to be able to spread the word and have that be an integral part of the materials. I mean, remember during the AIDS epidemic, there wasn't a theater house across the region that didn't have a playwright dedicating plays to HIV/AIDS. Yeah. Right, and as you were saying, that same level of critical, sustained focus is what we're not seeing within the context of this crisis. Exactly. And there is ample room to begin to express that using different forms.
There certainly is.
Right, and so to see that as a viable way, and then perhaps even wrapping it into a competitive thing. So if you know that with NIFCA dedicating whether it's prize money or some kind of thing that is specifically speaking to, so wanting to see acts and schools participate in some kind of aesthetic programming or creative expression that is dealing with this topic. And I think this is the way you can begin to make it applied knowledge that then could then roll out to the greater society.
And then we just heard mention. Oh, go ahead.
I wanted to kind of highlight the importance of the children in our solution.
Oh, completely.
So we have spoken about them a bit, but the idea that we have the children and they're in a home environment. We really need to think about that home environment. I think it's not as good as it used to be. We need to strengthen that. That home that child grows up in. You know, when I think of us coming out of the COVID pandemic and people in their rooms on a screen, you know what I mean? Many of the children nowadays are up at night, you know, playing games. They're not engaged with their family unit, and you know they're developing practices of staying up all night and sleeping during the day. And these are things that we know, you know, will you know cause problems for decades. So I think that, that home environment and trying to optimize it for the optimal development and growth and culture, for the child. And then also the idea that this child, if adequately nourished and educated, becomes an opportunity to speak to the parent, the grandparent.
Exactly.
You know what I mean?
The friend.
The friend, exactly,
know?
to really help to get that
auntie, the
message,
uncle,
that
yeah.
positive message that we want. And I mean, of course, the role of the school in terms of the school environment, what's being done there. Talk about the child obesity prevention project. You know what I mean? I don't know what's happening here in Barbados in terms of physical education, whether or not, at a certain period it's no longer mandatory. I don't know. I know we're having that issue in Jamaica where in some schools it's no longer mandatory. But maybe, really pushing to have our children be active.
Exactly.
And, them seeing that as a priority, them owning that and wanting to do that, not just because they have to, but because they want to. And I think that's how we change the culture for the better.
Right.
For the next generation and generation after.
And the culture of the workplace too.
Yes.
So whether, as opposed to a Friday lime, after work lime, it's a Friday after work hike. And
There you go.
incorporate other ways in which you could build community and a sense of belonging and collective spirit.
That's healthy.
That's healthy, right?
Yeah.
That allows you to enjoy your drink and your water, but also through exercise as
Yeah.
well, and you put it into those moments to.
You think we need to maybe have health ambassadors in each of these spaces?
I think so.
I think so.
I think so.
Just to help
I think
to grow
so.
what that program would
Right,
look
to
like
what
in
that
these different
program,
areas.
in every workplace, and that there is that kind of mode and those family fun days that are part of that active engagement with each other, getting physical and
There is one important product that I want to come out from this panel, but I know there's a question in the audience from I think there was one. Yes, I'm taking over your role, Shane.
It's okay. I know you tend to do as you like when you're ready.
Carlene?
Good evening. Not really a question. Actually, some of what I was going to say, Marilyn just said. I think sometimes we underestimate how powerful children can be in influencing
Adults.
those around them. And I say that I think some of us have had in our own practice. I, for one, the granddaughter that comes in, when there's a little one that comes in and says, yes, her numbers are good, doc. Because, in the previous appointment, we discussed what the goals were for the blood pressure. She took the blood pressure for her grandmother. She has the paper, and she comes, yes, they're good, doc. So it's very powerful because sometimes they listen to them more than their own children.
Indeed.
They have that special sort of bond. So we have to use these, links and relationships that exist already to bring across these points that are very important. The other thing I wanted to say is in terms of the STEMI network that we've been trying to establish in the region and so on, that Marilyn and Dawn, you mentioned, it's one of the prohibitive things, I think, is the cost of all of these procedures in the region and trying to wrap our minds around how do we make these available and accessible. Because yes, in some countries, a cath lab is not possible. We're talking about air ambulancing a patient out to another Caribbean territory where it's possible. And sometimes that's just not even something that people can dream of, far less. And we're talking about making it available to everyone who needs it. Part of that is because we are consuming as individual countries.
right.
Exactly.
Across the waters from St. Lucia, we have our dear colleagues in Martinique, but they're Petit France.
Yeah.
They consume as part of big France.
Exactly.
And so their costs are much lower. Granted, they're probably a little undercosted, but that's not the point. They're much lower than what we can offer in other territories. And so this is part of why the Caribbean Cardiac Society is so important as we network, as we come together to see how can we be one consumer, or at least two, to try to make our numbers come together and approach all of these vendors and all of these persons as one. And so that will trickle down to our patients.
Exactly.
And that's of course, an intervention that's at the level of Cardiacn.
And
Exactly.
Further to that, Dr. Scantlebury, I remember recently on the radio show, on the Pulse radio show, you mentioned the QEH's role as a Caribbean hub, what your vision for it, what you would like to see happen in terms of treating our brothers and sisters across the region. Maybe you can expand on that here.
So going back to Curleen, this is Dr. Curleen Snack. She's one of our members of the society coming from St. Lucia for a meeting. So we have these hubs across the Caribbean that are capable of tertiary level cardiac care. So, Barbados, Trinidad and Tobago, Martinique, up to Jamaica. And there are other islands that are trying to do a little bit more advanced care. But ultimately, some of the procedures we do, you need to do a fairly high volume in order to do them very well. So, cardiac care works best in a hub and spoke model, where you have the hub, which is the tertiary care center, which is capable of doing, lots of procedures, high volume, as a high volume center with fancy procedures. And then you have all the spokes of this wheel. So if you think of it as a wheel with the little central thing and all the areas outside, you start the care, and then depending on what's going on with the patient, they're then directed towards the hub for more advanced care. So when it comes to managing a STEMI, the big heart attack, the advanced care can be very expensive. It doesn't have to be, though. And that's one of the things that we as a society and as a region need to advocate for. Yeah. We are small fish. We're also small fry as far as some of these big vendors are concerned, the big device companies, pharma, etc. And they don't care about us. But when we approach them individually, we get eaten alive. Yeah. If we present a unified front, then we could have a better voice. So that's one of the reasons why the CCS exists, to try to see if we can present that united front. We can get and negotiate prices down. We can then manage our patients a little bit better. But as I was saying, one of my visions would be for QEH and I guess other centers across the region to be those hubs. But you also need to develop the spokes. And one of the issues that we have is even those spokes, some of the spokes are broken. So in some areas, there are no cardiologists. There are very few ECG machines. Even the basic diagnostic devices and procedures that they have aren't sufficient even to diagnose a heart attack appropriately. So, you can't even get to the point of diagnosing that heart attack to get it to the hub. So we need to develop all of these, and that has to be a regional thing as well. Again, because, like, say, Grenada doesn't have a cardiologist. So, who's going to develop the care there? It has to come from us, because we have to look after our brothers. We are our brothers' keepers when it comes to healthcare.
You took the
Literally.
words right out of my mouth. You wanted to add to that, Dr. Connell?
Yeah, I wanted to respond to Suleiman's comment because I sometimes think when we are having conversations about health in a setting like this and talking about behavioral change, the key players are actually not in the room. Actually, the main players here on this stage are actually yourself and Yannick, because where is the conversation occurring where everyone is at the same table, all with a vested interest in changing behavior? The social scientists, the cultural practitioners and cultural experts, the media, all of these people need to be on the same table, because what we're discussing is health outcomes, but they're happening because of behavior. Right. The only way we can change the outcome is if we change behavior. None of us as medics here, we don't have that expertise. Yeah. We do not have that expert. We can recommend what are the risk factors. We can suggest what are some of the social determinants. We're not even experts at that. And sometimes I wonder if by the time this conversation gets into the faculty that I am in, the faculty of medical sciences, whether it isn't too late. This is where the social scientists need to be involved to tell us how do we change society's behavior and the whole construct. This is where the psychologists need to be there as well. Because if we think about this as a health solution, it is not a health solution, it is a health problem. The solution is behavioral change. And health is not the expert at behavioral change.
No, actually, I'm talking about social media and behavioral change. During COVID, I got myself immersed in Twitter because that's where a lot of the images and the messages came from. It's now X, but it was Twitter at the time. And I remember reading this rant by a behavioral change specialist. I can't remember what her correct term was, but she was a behavioral change specialist. And one of her things was, you did not come to us to talk, to figure out how to lead the COVID effort. You know, you went to the physicians, you went to the media, you went to these people who, yes, know how to treat COVID, but you don't know how to talk to the public.
To change behavior.
To change that behavior. So that's where we need to go. We need to talk to the specialists.
But behavior isn't in situ, it happens within context.
Absolutely.
So changing the behavior also requires a revisiting, rethinking, redressing of the environment in which these behaviors are occurring.
Right.
So in terms of, shifting some of those contexts would allow for more optimal kind of practice to then be able to exist.
Absolutely.
The question is, how do we change culture?
Yeah.
Is it possible? How do we change the culture?
Yeah. And the solution might be getting the key players at the table to begin with. The sociologists, behavioral specialists, clinical psychologists, the cultural specialists, the artists, getting this. The question I'm asking, Shane, is quite simple. Is there a platform or even an environment for that conversation to occur? And there isn't. In this space, speaking about changing behavior, we actually don't have that environment or the key players in place. You have doctors saying, oh, look, the heart attack rates are going up and stroke is going up. Then you have consumers saying, it's not our fault, you guys just need to choose your food healthily. Never mind, you can't really tell what's in it, just choose healthily. And then you have to say, no, you need to get out there and move more. Everyone has given their opinion, but it's not evidence-based because you don't have the behavioral specialists in the room. How do you change culture? How do you change the psychology of people? At what stage do you do it? How do you get your messaging out in media? This conversation has to occur. And I think at a national level, we need to have a task force, for lack of forming another task force, right? That addresses change in behavior to bring about health outcomes.
One thing for sure, there's a lot of work to be done on the ground, but it's all about picking a time and place and making sure that your audience gets the message. Those are some of the key things that you need to do. Let's go back to the audience quickly. We are short on time now, so let's get a couple more questions from our audience here.
Yes. Hello. So my question is more of a comment and a proposal to you as lead members within the institution that is the UWI-Vale campus. So as a student who transitioned from biology to Caribbean cultural studies, this talk was interested to me because I was wondering how you're going to blend the cultural anthropology with the aspect of the sciences. But I think a more serious consideration would be whether or not we consider Barbados to be in a food apartheid, because we have to consider the aspects that although we are a predominantly Afro-Caribbean or predominantly black community, there's still a lot of segregation within our food community. So you mentioned that when you travel, you feel more open to trying new foods or you feel more accessibility to fruits and vegetables. However, we have a serious issue in terms of a food pandemic here in Barbados. Because, for example, the price of coconut water has gone up several times for the past couple of years.
Several times.
Exactly. And my proposal to you as members of the UWI-Vale campus would be to foster a connection with your student representatives. Because there are mandates that student representatives are told they have to uphold during their stint. However, it'd be interesting to see if there can be a mandatory connection between the student rep for medical sciences and the student rep for the Faculty of Culture. because they're stipulated to have to go through a certain amount of activities per semester and per year. And the campus has several FETs per week. They have faculty week, they have faculty week, they have several activities. However, we don't have somebody who's, or even a collaboration that's coming together to say, okay, at this FET, maybe we can serve something else other than strictly alcohol. Maybe we can foster a connection between MedSci and FCCPA to show how creatives and cultural theorists can actually aid in facilitating these ideas that you've presented thus far. And that could actually build the foundation to other projects that you've listed.
And
So
also
those are
could
my
be
comments.
infectious to faculty, because
Yeah,
students
exactly.
will lead on it. And I'm really happy to see I'm also happy to hear you've transitioned from biology to cultural anthropology. But the cross-fertilization that is occurring is actually occurring very slowly. You're right. And it could occur at a faster rate. But the good news is it has started. For instance, did you know in the Faculty of Medical Sciences, we use theater students to train medical students in dealing with difficult situations, and also to train them in the cultural aspects of how they respond. So UB, again, an indigenous university, we want our students to have an authentic experience of what it means to counsel someone about not having 3 pigtails in your rice, right? Right? We can't bring an American actor to do that. We have to use our own local culture, and our cultural students or theater arts students under Lisa Cumberbatch is very much involved in that program. But what you are suggesting takes it to another level. Wouldn't it be ideal if a regional university had a strong student organization that addressed behavioral change for NCDs? And wouldn't it be fantastic if it was cross-faculty?
Exactly.
I'm not suggesting any university, but wouldn't it be ideal if a regional university did that?
Thank you for that targeted response, Dr. Connell. We're very short on time. Just one last question from the audience before we get some final comments from our panel. Any further questions? And just to add to that, tonight we have Chef Adrian Cumberbatch here with us, who has put together some healthy delicacies for the audience and, of course, for the panel, because, of course, we are promoting better health, better diet, and, of course, moving away, hopefully,
unhealthy stuff.
in the very near future from this scourge and high prevalence of cardiovascular disease. So let's come back to the panel, and I'm going to go in this direction for those final responses. So let's start with you, Dr. Connell.
Right. So my 2 final responses are final thoughts. One in response to our student. I think this is an important product for UWI. A trans faculty cross-fertilization of young thinkers and thought leaders to change behavior towards NCDs. Students from medical sciences, culture, creative, performing arts, science and technology, all get together under the guild of students to really tackle a major public health crisis. That's one. The second one is there now needs to be a national platform where behavioral specialists and related disciplines can discuss change in behavior, right? The NCD Commission has a model that is close. There are many stakeholders on that commission, but they're not specifically there to address behavioral change. So as long as we've recognized that, yes, it is a health outcome, but we need to change behavior, we now need to create a space with the Ministry of Culture, with all, and the specialists in those areas to specifically address behavioral change for lifestyle and non-communicable diseases.
Okay.
Yes, I definitely want to echo that, and I think we've had a wonderful conversation here this evening. I think it's relevant to Barbados, it's relevant to the entire region. And the question is, how do we continue this conversation and have others who aren't participating in it tonight know that the conversation is happening and have their part in it? You know, so how do we sustain this? How do we invite others to the table? Is it something that we can do online through a blog where people can participate according to their time?
Yeah.
I think we don't have to all be there at the same time, you know, and as we kind of try to refine how we're going to do it, can we engage the entire region?
Yeah.
You know,
Sure.
how do we have representatives in the different areas, and how do we learn from each other's successes and failures? How do we know how to, you know, pivot and really kind of have this conversation be a regional conversation that can have an impact, you know,
And a
for
regional
the entire
response.
Caribbean,
Yeah.
and a
Yeah.
regional response.
That's
indeed.
critical.
Yeah.
Regional solutions.
Regional solutions, indeed. And I think seizing the moment and the media that we have access to, recognizing the power of social media, recognizing the power of our various digital devices. And you spoke about, you know, how do we get together? People are getting together with people all over across the world with this device they hold in their hand. So how do we then create a space where the evidence could be part of what is then informing the information that is going out there that we're creating, and recognizing that we have platforms available to us that we're underutilizing. And so in part of how do we sustain this is making this agenda part of those, inserting that in these various platforms of which we could have an audience, and we could hold space with that audience.
Okay. So, kind of to summarize what I hear coming back from everyone is that we're all very passionate about this area. It is the space we occupy, obviously, but it's vitally important to everyone. And it reminds me of the World Heart Day theme over the past few years, to use heart for something. So you use heart for your community, use heart for each other. It all comes down to, you know, looking into ourselves and, you know, seeing at the core what is important in life. So, you know, that's one thing I just wanted to crystallize all of this to. You know, this is vitally important because it's our lives, it's our hearts, it's our love, it is our health, it is, you know, it is all about the heart. And we need to use heart in every sphere of our influence to improve each other's hearts.
Oh, beautiful.
And very
I like that. Yeah.
About tomorrow and the events to come.
This weekend.
Okay, so the Caribbean Cardiac Society, as we've been discussing, when was it formed, Marla?
In about 1986.
In 1986. This is our 37th annual conference. We had a hiatus over COVID, 1 or 2 years. And we come together for 4 days. As I said, cardiovascular specialists from around the Caribbean come in. We try not to pitch it too highbrow because we're speaking to our local audience as well, nurses, physicians, general practitioners, internists, etc. But we want our local audience to come to learn. So on Sunday, for instance, we have an ECG workshop, and that's usually one of the best subscribed days of the conference because it's something that everybody in the medical community wants to learn. So, you know, we start off with the interventionalists talking about cases and sharing, and we want to invite industry to the table to talk about how we can make things better for our people. Then there are, you know, true scientific sessions. So people have submitted their research abstracts, and they're going to be presenting their research abstracts. Like Dr. Connell said, my first presentation was at a Caribbean Cardiac Society meeting back in 2000. It was Dr. Massey who pushed me to do a case. And that's what got me started, actually. At that point, I was not interested in cardiology, but you go through cardiology, and the cardiologists get you hooked in research, and it's the culture, actually, to learn more, to quest more. So abstracts, scientific abstracts, cases, learning, and then a little bit of enjoyment as well.
A lot of enjoyment.
Yeah, a little bit of crossover.
Interesting days ahead indeed, and I really want to start by thanking, or wrap up really, by thanking all of you for coming and sharing your knowledge, your expertise, but also offering proposals and solutions for how we tackle some of these issues as these societal problems. Cardiovascular disease is a big societal problem for us here in Barbados and across the region. And this is one step we hope in the right direction. As you mentioned, Dr. Connell, we need to find more opportunities like this to touch more people, to help them to understand and break down some of the misinformation as well that is out there about cardiovascular disease and other NCDs. But this is the platform that the QEH is using right now. We'll continue the outreach during this 60th anniversary. But again, a big thank you to our visiting friends, and of course to you, Dr. Connell. And I can't believe that your name would have slipped me now, but Dr. Scantlebury.
It's okay.
Late hours.
It's 9 o'clock.
And smelling it too. But also a big thank you to the audience here for coming and spending the time with us to hear our experts, and also to share your knowledge as well, and your solutions, your proposals for how we deal with this crisis as far as CVDs are concerned.
And happy crop over.
Happy crop over. It is not over yet. We have still a few more days. But I hope this helps people too to be a bit more cognizant about what they're doing out and about as they enjoy themselves. Yes, you cannot get away from the elephant in the room, the alcohol. But you can also adjust your consumption and drink more water. Definitely helps.
Lack of sleep.
Thank you to our viewers online for chiming in as well. The questions keep coming in. We wish we could cover more, but we will have more health talks, and of course we'll stay connected, because we don't want these to be one-off forums. We have to keep hitting the public with the messaging, and really hope that it gets into the psyche and helps to change these cultural norms that we exist in. Not only during crop over. Christmas is one of those.
Oh yeah, for sure.
Battlegrounds that you'll have to fight as well, Dr. Scantlebury and team. But again, thank you all for sharing with us tonight. This has been another edition of our Public Health Talks. We'll have another one later on in the year. Of course, the hospital, through the communications department, will send out the correspondence so that you can chime in and join us as we continue to reach out to the public. It's all about promoting better health care through our hospital. Thank you for being a part of this.
Thank you. Well done.
So it's time.
It is my time to jump up, my time to race, my time to jam and mash up the place. Sometimes I feel like the bills gon' kill me, but I'm still holding on and standing strong with the love soca give me. Cause when I hit on the road, I get to the show and jump on the stage. When I see your face, I run on the soca, lashing me braid. The all me problem just vanish away, because right now soca make me jump up, back and I lay me bed. Setting make me walk up, liquor just ease the pain. Soca make me jump up and put up me wag and jump up and lift up me flag and jump up. I out on the road again. Drink the rum, tumble them, pan the rum, trample them. Have your fun, have your fun. Soca therapy. Drink the rum, tumble them, pan the rum, trample them. Have your fun, have your fun. Soca therapy. Oh 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 oh. Baby, touch down on the road, you know it's pure bacchanal. Oh 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 oh. Raise your rag now, raise your rag now. Sometimes I feel like everybody won't fight way, but I'm still holding on and standing strong. Cause I know soca like way. Cause when I hit on the road, I get to the show, I jump on the stage. When I see your face, I run on the soca, lashing me braid. The all me problem just vanish away, because right now soca make me jump up, back and I lay me bed. Setting make me walk up, liquor just ease the pain. Soca make me jump up and put up me wag and jump up and lift up me flag and jump up. I out on the road again. Drink the rum, tumble them, pan the rum, trample them. Have your fun, have your fun. Soca therapy. Drink the rum, tumble them, pan the rum, trample them. Have your fun, have your fun. Soca therapy. Oh 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 oh. Baby, touch down on the road, you know it's pure bacchanal. Oh 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 oh. Raise your rag now, raise your rag now. Now everybody say. Them see you clean and got your front end of the house. Them I hate you, they see you get the money now. Let me tell you how life is. Some people bad minded. Them see you clean and got your front end of the house. Them I hate you, they see you get the money now. Cooper down on the mic, everything just right, yeah. I've been in situations with no one to help. Had to put myself in a position that I can help myself. I go live life without no restrictions. As long as I ain't good at, I can be greater. Give thanks to the creator. Yeah, get the best to get me upset. Try everything to knock me down. That can happen again. Can happen to me. I treat them with love and show them respect. The same ones will come and let you down. That can happen again. Can happen to me. I won't let no woman trick me no more. No friend can diss me no more. That's impossible. That is impossible, yeah. I'll be the provider for them, I'm sure. But my family can't suffer no more. That's impossible. That is impossible, yeah. You see all the sacrifices that I done made for some individual. Careful who you trust out there. I just can't trust him. I see the sacrifices that I done made for some individual. Careful who you trust out there. Pouring my love and my all into humans. Can't happen again. Have to cleanse and return as a new man.
I'm Mr. Alligator.
Be more confident. Free my mind and come up with my own plan. I had to think different. Now I feel safer. Don't have to mix with traitors. Yeah. Get the best to get me upset. Try everything to knock me down. That can happen again. Can happen to me. I treat them with love and show them respect. The same ones will come and let you down. That can happen again. Can happen to me. I won't let no woman trick me no more. No friend can miss me no more. That's impossible. That is impossible, yeah. I'll be the provider for them, I'm sure. Cause my family can't suffer no more. That's impossible. That is impossible, yeah, yeah, yeah. See all the sacrifices that I done made for some individuals. Careful who you trust out there. I just can't trust him. I said the sacrifices that I done made for some individuals. Careful who you trust out there. I just can't trust him. Rock and come in. I just can't trust him. Rock and come in. Rock and come in now. And I can never get why. Rock and come in. I just can't trust him. Rock and come in. Rock and come in. And I can never get why. Them see you clean and got your front end of the house. Them I hate you, they see you get the money now. Let me tell you how life is. Some people bad minded. Them see you clean and got your front end of the house. Them I hate you, they see you get the money now. Let me tell you how life is. Some people.
So everyone can just head to the back of the Standard showroom to take part in some of the delicacies prepared by our chef Adrian Cumberbatch. Also, Standard distributors always being the good corporate citizen and really being a part of the QH's journey as we do this outreach. They have a special gift for all of you who attended tonight. So all of you who attended tonight will be getting a gift voucher from Standard Distributors. I'll tell you a bit more in a minute as you enjoy the food.
And I
So let me pass you over to Miss Halliday so that she can bring you up to speed on all of the offerings of this beautiful showroom here in Wildy. And as you have been our special guest, she always likes to let our guests leave with some treats, some gifts. You can't leave here without a gift.
Absolutely not. We always love to co-host these talks with you. This is our way of being able to give back. And we also want to give back to the persons who attended. And our way of doing that is that all you have to do is keep your ticket. If it's your e-ticket on your phone, you just present it in store before the end of July, and you're entitled to $50 off of your next purchase. For the panelists, you actually get an extra special treat because you're entitled to $100 off your next purchase. Okay, so just present it in store to any CSR. For the ones with a $50 voucher, it's a minimum spend of $100, which means that it's up to a 50% discount. And similarly with the $100 voucher, a minimum spend of $200, which is up to a 50% discount. So enjoy the rest of your evening. Thanks for coming.
Thank you so much. Standard, of course, giving back as a good corporate citizen to us at the QEH and by extension those who we serve, the public. Thing from me. No dancing from me at all. Physical activity would have to be in the gym. But I just want to say for those of you who do not have your e-ticket, you can check with Sophia Williams once she finishes behind the table, and she will provide you with your e-ticket so that you can claim your voucher, your gift from Standard Distributors here in Wildy. Yes, a reminder, you have until the end of July.
Top,